Simply defined, osteoarthritis is inflammation of one or more of your joints. And osteoarthritis is most common and generally affects older people, though it's not always older people that get osteoarthritis, because when many of us have a fracture, particularly those that damage the joint surface, these are the most common injuries that lead to arthritis. And even when properly treated, an injured joint is more likely to become arthritic over time. Now, the most common medications for arthritis are anti-inflammatories, which stop the body from producing chemicals that cause the joint swelling and pain. And even to the more extreme, when anti-inflammatory medications are not appropriate, injections may be used, and these typically contain a long-lasting anesthetic and a steroid that can provide pain relief for weeks to months. But the downside is that they can only be repeated a number of times due to the possible side effects, such as weakening of tendons and ligaments, and of course the worst case scenario, infection. So is there another way that we can help these joints that isn't as extreme as having to go down the track of prolonged medication and possible injection? But using your sanakey, you can go a great deal to mitigating these possible side effects and the need to go down the path of medication and possible injections. This is a great device to reduce inflammation, reduce pain, and increase your functional capabilities, actually moving those joints. Now, it's not going to reverse the osteoarthritis, but it's going to help restore a great deal your movement. So what we're going to do is we're going to treat small joints with a selection of 3 settings, and they are sedation, relaxation, and activation. And what you're going to do here is choose a joint to treat and focus on that joint, and using those 3 settings that I've mentioned, treat that particular joint. Now, if you're not sure how to choose those settings, just pop out of this video, go back to the instructional video of use and operation and look how to use those settings. Now, what we're going to do in this particular video is choose a joint to treat which you will use as your sorest joint, but in this example we're going to treat the thumb joint. And what you're going to do in this particular method is you're going to just simply place the device on the joint. So at the first stage there's going to be no brushing, and what you're going to do is turn the device up until you feel it at quite a strong level. Not too strong that it's hurting, but fairly borderline hurting, and you're going to leave it there. And what's going to happen is after a little while, the impulse that you feel is going to back off as if you have turned the device down. As you can see, the device is not being moved on the thumb, but as soon as you feel that signal reduce, you're going to turn the device up again until you can feel the impulse strong on that joint. And you're going to wait again until you feel that impulse back off. And once again, turn the device up until you can feel it fairly strong. Now, the goal here is to get to a stage where you are holding the device there and it tends to increase without you increasing the energy. So what I'm saying is that you will find that as you increase the energy level, the device will at one point begin to feel stronger without you increasing the energy level. And what you're going to do is at that time leave it for 10 seconds and lift the device off, and then check the movement of your joint and make sure that there's A, pain relief, B, more movement, and if there isn't, we're going to simply repeat the process again. And what you're going to do once you're satisfied with more movement, you're going to end the treatment by switching back to your basic setting and a comfortable level of power, and brush the area, looking for those common sticky points that you already know how to look for. And just brush the whole area until you have no more stickiness, and then also check the assess your treatment by checking the movement. Now, if you want to take the treatment one step further, we can finish the treatment by applying an osteo cream or physio cream or any sort of cream that you have or that you use for your arthritis using the keyphoresis setting. And what you're going to do now is you're going to put the cream on the joint area and you're going to choose the keyphoresis setting and go into the KP acid setting. Most of the creams that you have will be in the KP acid setting, and all you need to do now is increase the energy level. You're not going to feel it. If you do feel the energy level, you are too high because it's a different setting. As you just saw, you're going to put cream on your fingers and you're going to hold the device by using those ontophoresis electrodes, and it's a very simple process of rubbing the cream in. And you can keep treating until the cream's all rubbed in. Don't forget to clean the head of your electrode. And you can do this treatment for all the joints on the fingers and on the feet by using that method of increasing the impulse level and then finishing off with the keyphoresis.